Hi, everyone, and welcome to the 17th episode of Vitals and Voices. I'm Lathika, and I'm the founder and host.
I'm Camden, and I'm the co-host, and we serve on the executive team of Vitals and Voices.
Vitals and Voices celebrates the people who drive true purpose to the healthcare field. In this podcast, we interview leaders, mentors, and everyday changemakers in the healthcare world whose passion and stories for service continue to inspire countless people.
Please welcome our guest, Dr. Salame.
Hi, everyone. I'm so glad to be on this podcast. Thank you, Lathika and Camden, for having me. I'll just introduce myself. I'm a double board certified and fellowship trained medical, cosmetic, and surgical dermatologist and Mohs micrographic surgeon. I completed my medical school training at UC Irvine in Irvine, California. I then went on to dermatology residency at Emory University, which is in Georgia. And then I completed a cosmetic dermatologic surgery fellowship at Skincare Physicians, which is right outside of Boston, Massachusetts. I currently practice cosmetics, medical, and surgical dermatology in both Manhattan Beach and Palos Verdes, California.
Oh, wow, that's wonderful. That's a lot of professional background that you have. So our first question is, what originally inspired you to pursue a career in healthcare, and how did that path lead you to dermatology specifically?
Yeah, I get that question a lot. I think everyone's moment when they decide to become a doctor or pursue, science or medicine is very unique. I remember my first time that I knew that I wanted to do something in science was actually in sixth grade. I had a science teacher whose name was Miss Rush, and I'll always remember her. She showed me how to use a microscope, and she showed me penicillin underneath the microscope in a dish. And I remember her telling me the whole story about how penicillin was a kind of a mistake, but the discovery really changed public health and allowed us to, develop antibiotics and extend life expectancy. And I remember being so young and thinking, oh my gosh, this little thing in a petri dish that I'm looking underneath the microscope at really changed the world, right? And I said, oh, this is something I want to be a part of. So I decided at that point I wanted to do something in science. I originally thought I was going to do a master's in public health and work in the public health sphere. I applied to UCLA and I was really lucky to get there into UCLA on scholarship. And when I started kind of pursuing public health in that at UCLA in college, I realized actually instead of doing something in public health, I want to be a practitioner and be someone who can prescribe and treat patients directly. And this was really something I discovered through a lot of mentorship and asking questions and shadowing and talking to a lot of people along the way who showed me, what a life as a public health, in the public health domain would look like versus in medicine. And I had a lot of mentors really encourage me and inspire me to pursue medicine. And then I switched my career to pre-med, which is a long road. And, you said, you have quite a bunch of accomplishments. Becoming a doctor is such a long journey and listing all the things I did to become a doctor, all the accolades and all the things that your training is such a long journey. And I think, when you set out as a young student, deciding that you want to be a doctor, you don't really realize even in that moment, the long journey that it really does take to become where I am. But I did end up thankfully becoming, a medical student at UC Irvine, which is kind of the biggest, hardest step. And then when I was there, I originally thought I was going to be an obstetrician, an OB-GYN. I really wanted to deliver babies. That's kind of what I thought I was going to do. And then I discovered dermatology. And I think dermatology is something that a lot of medical students don't really get a lot of exposure to. But once you do, enter into the dermatology world, you realize there's a lot of benefits to becoming a dermatologist. You get to really have long-term continuity with your patients. You can treat patients, their family members, the eldest, the youngest, and really be the family dermatologist, which is something that I really love that I do in my daily life and my daily career. That's really fulfilling. I also realized that dermatology allowed me to really treat, many things, medical, cosmetic, and surgical. I was able to do small procedures that were really impactful for patients. And I could really mix kind of clinical care, small and complex procedures, and cosmetic treatments in one day, which is a very fulfilling thing to have in a medical specialty, an option to have in a medical specialty. And then another really important thing about my career, which is not really spoken about when you're in medical school, is that it really does give me a lot of work-life balance. I have a lot of fulfillment in my career. My patients tend to be very happy and satisfied, and that gives me fulfillment. And then I also have time after work or on weekends to be with my family and to build a family, which is something that I really value. And I'm really fortunate to have that in as a dermatologist. So that's kind of a very long story about my path, which is a very long path to become a dermatologist.
Well, I love to hear about that path, and I'm sure others do. But what would you say was the most challenging part of the med school application process for you specifically? And what advice would you give to somebody applying?
Yeah, that's a really good question. I think everyone has their, every application, medical school application has kind of their pitfalls or, their weaknesses. But I think for the medical school application for me specifically was finding a mentor, which is very difficult, especially when you're young, pre-med and you're in a competitive, specialty. For example, if you're at UCLA, which is where I did my undergrad, there are so many pre-meds there. And when you're applying to medical school and you're looking for a mentor in a really competitive landscape like UCLA, it's really difficult to find someone to believe in you. And it's really hard to find someone to believe in you when you really don't know what you want in your own career. So when you're kind of in this path, you're saying, I want to be a doctor and I really am looking for a career that fulfills me. It's really hard to get someone to inspire someone to believe in you when you're still, discovering yourself. And I think that was the hardest part for me in my journey. So it involved me, reaching out to, I think I sent over 100 emails to different faculty members at UCLA with a cover letter, my resume saying, I'm pre-med, I'd love to work in your lab. I'd love to work on a project with you. I'm looking for a mentor. And of 100 emails, I think I got 3 responses. And of those 3 responses, I was able to work with one person who really did believe in me. So I think my advice in that regard would be always, knock on every door. Don't be discouraged. This is the hardest part is to find someone to believe who believes in you and who's going to mentor you. And the best part is that once you do find that person, they can really shape your career. So finding the best mentor is so important and it really does take some time. When you do get into medical school and residency and all those other steps, fellowship, finding mentors is easy because you're in a program where people signed up, faculty signed up to mentor you, and they believe in you because they accepted you into their program. So that becomes a lot easier along the way. But getting your foot in the door is the hardest part of the medical school application.
Yeah, I definitely agree. And I really love how you had perseverance during the whole process. And that's definitely one of the things to have in medical school. So I'm really proud. Um, so your journey in dermatology combines both medical and aesthetic care. How do you balance the science of treatment with cosmetic dermatology in your daily practice?
Yeah, that's a really good question. I think once you get into dermatology, you realize that the medical dermatology or the science of medical dermatology, treating medical conditions in dermatology and the artistry of cosmetic dermatology are really the same thing. There is, artistry in treating medical conditions, especially if you add the, empathy and the compassion that it takes to really care for patients who are dealing with these really complex dermatologic conditions. That takes a lot, taking care of those patients takes a lot of artistry and care. And then, taking care of cosmetic patients, if you're doing cosmetic procedures the proper way, it's really a science, right? A lot of, in this current age, a lot of people are doing aesthetic treatments without the proper training and not understanding that there really is science behind doing a proper cosmetic dermatologic treatment. So, if you're going to pick up a laser, there's a lot of science behind using that laser. And it's not just artistry and it's not just combining procedures to get the right end result. It's really knowing, the dynamics of using a laser on skin and what you're expecting to see, and the planes of injecting your filler to achieve volume safely, the planes of the face. So I really do believe that science and artistry are seen in both medical and cosmetic dermatology. And the best cosmetic dermatologists have a really strong backing in medical dermatology.
I love that you blended the two together, and I love the patient contact you have as well. So, for your love of patients, given your strong advocacy for them, and safety in cosmetic medicine, what steps do you believe patients and providers can take to ensure ethical and safe cosmetology procedures in today's med spa culture?
Yeah, I get that question a lot. It's really unfortunate that the onus for safety in this kind of landscape where there are these med spas really does fall on a lot on the patients. You know, for providers, we need to keep showing up for our patients. It's really easy when someone comes into my, clinic in my dermatology clinic and asks me questions on, how can I navigate this landscape? What treatments are safe for me? Then it's easy because the patient is there in the chair and I have kind of this platform to speak to them. But really the difficulty is showing up online, where much of the misinformation about cosmetic treatments and even skincare is just really perpetuated. And there's a lot of responsibility among like a felt responsibility among dermatologists to show up online to kind of debunk the misinformation from, influencers and wellness influencers online. And it's really hard to show up online in these ways, in trendy ways that will go viral when you are, a busy full-time physician. So that's really the difficult part is being able to, get to patients, and then have them believe you over a wellness influencer who has, minimal training and experience. So that's the hard part, but it's easier when patients are, in the clinic asking questions and, they've showed up, they have the right questions, they're the right patient who's looking for the education. So with all that aside, it really falls on, unfortunately, on the patient to be able to identify the right practitioner. I think I tell patients all the time, ask for the credentials of your injector, ask for the credentials of your provider. If they don't want to share their credentials, that's a red flag. Ask who is the overseeing physician of the clinic that you're getting your treatments if you're going to a med spa. If the physician is not on site, that's a red flag. If the physician is not aesthetically trained, for example, if they're an obstetrician or an ER doctor without the correct cosmetic training, that's a red flag. So just, educating our patients on what to look for to keep safe. And I always encourage patients to, really invest in themselves because when you're going to seek cosmetic treatments, you're investing money to look better and you want to do that safely. And I think if it's better to invest fully in yourself than to take shortcuts and risk your safety. So that's been a big part of how I speak to my patients about it. If the cost of the medical procedure at these spas is so low, that's a red flag too. You're paying for a medical procedure, and that's always something that is emphasized. It's a medical procedure with real medical risks.
Yeah, definitely. Totally 100% agree with you. So what's a medical topic or issue that you're deeply passionate about, and why does this topic really matter to you?
I think we already kind of touched on it. I mean, I'm passionate about many things, and there's a lot of things within my field that I'm passionate about. But a medical topic that I think has just really become forefront, not just to me, but a lot of cosmetic dermatologists or people in this field and in this space is how to be able to treat patients who are going to these med spas and how to, it's become really a public health safety concern because we're seeing patients who come from these med spas with these serious complications asking for help. We're seeing, these medical procedures being performed by unlicensed or undertrained, practitioners who, are performing procedures that are legally outside their scope of practice. And there's really no federal regulation or follow through to hold these providers accountable. And so what's really being said, in that regard is that these procedures are, it's more of a business and these patients are clients. They're referred to often in these medical spas as clients, but really the reality is these are medical procedures with risks. And when there's no FDA regulation that's backing these medical procedures, and if there's no red tape on who can perform these medical procedures, that becomes a real public health safety issue. And there's more and more, John Oliver had a skit about this a few months ago, and that really kind of raised concerns. But it's not until we get kind of those types of videos to go viral or more, federal kind of regulation, then this idea of patients going to medical spas and getting these procedures becomes kind of status quo until there's, a huge incident or a huge news piece that comes out where someone has an adverse event that's kind of horrific and it starts to make rounds. But really, until there's federal regulation and more public outcry, this is going to continue.
That's beautiful to hear. And is there anything outside of medicine that you're passionate about or just really enjoy that helps you recharge after a long day at work?
Yeah, I think that's finding the things that help you recharge is really important in medicine, whether you're a dermatologist, a surgeon. I think I'm really lucky to be able to leave work, at 5 or whatever normal business hour I have and be able to come home and not be on call. Obviously, I'm always available for my patients after hours should there be a problem, but that doesn't happen often. So I'm able to kind of turn off when I come home and be with my family, which is the best way to recharge, just be with my dog, be with my husband, walk on the beach. I live right by the beach. I work in the beach cities, and it's just a blessing to be able to recharge in that way after work. When I was in medical school and in residency, I didn't have that. So the way I used to recharge would be to travel. And I think, even though I didn't have all the financial means to travel, I still found ways to get out. And it was the best way to recharge is to just get out of your bubble and just turn off your mind and just be able to travel somewhere else and experience something. So that's been kind of the best ways, like traveling and just spending time with family now.
Definitely agree. I love traveling as well.
Me
Um,
too.
so I know you mentioned a lot about your mentor and how she or him were really supportive of you. But is there someone else in your journey that's been a really big influence on you or really supported you during this journey?
Yeah, I think no one else can take credit for helping me make it this far than my mom. She's like my biggest support system. She's been my cheerleader since day one. She was a single mom who raised me, and we come from very humble beginnings, and I am the first doctor in my family, so it was just completely uncharted territory for us. And she's a foreigner, she's an immigrant. So for her, it was even more difficult to navigate, scholarships and Cal Grant and all the things that really, the financial support just to get me to get into UCLA, was something she supported me through. And then through my pre-med journey, it was filled with so much heartbreak and tears. And I'm not going to make it sound glamorous. It was not. It was a hard, hard journey. And she was always there to support me. And when I became a medical student, there was a quarter I remember thinking, I don't think I'm meant for this. And I almost quit. And she was there to really just give me that encouragement. And the day I became a doctor, I told her she became a doctor with me because she was really there with me the whole way. And even now, she's always my cheerleader. She's always my number one support system. And I think having like mentors are amazing. And I have a lot of mentors that call themselves like my derm moms or, fatherly like, mentors in my specialty who have really supported me, but nothing replaces your family, if it's your mom, your dad, just or your spouse, that special person who, is there to support you and believe in you when you just want to give up.
That's so beautiful to hear, and I love that you and your mom still have that connection today, are both now doctors. Um, Going back in the past questions, you mentioned being passionate about ensuring patient safety in cosmetic procedures. What changes would you like to see in that injur oh my gosh in that industry regulations or educations the public that educates the public about these treatments?
Yeah, we talked about this a lot. I mean, it's really difficult I've looked into this, a lot of folks have looked into this. It's really hard to regulate this space. The medical board can only regulate physicians. So, when there are estheticians or when there are nurses or, PAs or NPs performing procedures, and they do undergo training, but there are things that they're doing that are way outside their scope of practice legally, and kind of just skill level, procedures that they don't have the proper training how to manage the complications. And you can't, it's above physicians when these folks are not physicians performing these treatments. So it really does take a federal body to kind of step in, and there needs to be more of a federal approach. A lot of this is now state by state legislation on who can perform what and what is the scope of practice for certain medical professionals. So it's really state by state. But I think really there needs to be a federal position and more federal laws to kind of safeguard patient safety in this realm. And I don't think that's going to happen because, until there is unfortunately, there are so many news articles and stories that are coming out and will continue to come out on these, bad actors in this realm and poor outcomes that happen with patients. But, that's just more of the shock factor in the media perpetuating these stories. But really, nothing's going to happen until there's federal policy and regulation. But a lot of these practitioners have really strong advocacy and in lobbying, so that becomes more of a political matter. And when public health and safety of patients is a political matter, that also becomes kind of an ethical issue too. There needs to be more respect for patient safety. These are medical procedures, there are medical risks and consequences, and it needs to be treated as such. So until the federal government steps in and does something about that, there's only so much that physicians can do, except for just kind of continue to talk about it openly, like I do, educate patients and encourage them to, seek the proper care with properly trained providers.
I definitely agree. So as someone who's published and presented many times, what role does research continue to play in how you practice and grow as a physician?
Yeah, I I published a lot. I did a research year between my third and fourth year of medical school at USC, and I work with Dr. April Armstrong. She's at UCLA now. She's the chair there, but at the time she was at USC, and so she taught me everything I know about research. And I think it really shaped me as a medical student, as a dermatologist, to always kind of be evidence forward, evidence based. And I think that also separates physicians from other practitioners in this field. Physicians are very much evidence based people, and they're taught to practice that way in medical school and beyond. So a lot of my practice is still informed by research. So I subscribe to several dermatology journals. The Journal of the American Academy of Dermatology, JAD, Dermatologic Surgery is another one, JAMA Derm's another one. I get these journals every month. I read through it, and sometimes I find articles that do kind of change or influence my practice. And I think when you practice medicine that way, you're really safeguarding patients and giving them the best outcomes. If you're able to, after medical school, it's not like your training is, or residency, it's not like your training stops, right? Medicine is a lifelong learning experience, and they tell you that when you're going through training, but you really learn that if you really want to continue to give your patients the best quality of care, you need to pick up the journals, you need to read the papers, and you really need to make educated decisions and go to conferences. I go to a lot of conferences, sit through lectures, and it's lifelong learning. So still a big part of what I do. I also still am active in research. I mentor a lot of residents through research projects, and fellows through research projects, and so I'm still contributing in that way. But now it's exciting to also be kind of a reader and someone who is still learning and growing in my field based off you know up and coming data.
That's so beautiful to hear, and congratulations on going to all those conferences and being published. Before we wrap up, what advice would you give to a student who may just be starting their healthcare journey?
Yeah, that's a question that I get all the time. It's really hard to give you one piece of advice. I think the biggest thing is knowing that this is a long road, and that's not meant to discourage you, but actually encourage you to keep going, keep your head up. The end is amazing. Medicine is just, long-term delayed gratification. You spend most of your 20s pursuing this field, maybe even into your early 30s. And at the end, you really do have, if you chose the right field that makes you happy, you should have, a fulfilling job that makes it worth it for you. But the road is just so difficult up and down, and you just really have to let your passion guide you. Trust that, it's okay to, I came into this thinking I was going to be an obstetrician, and then I became a dermatologist, so different than what I intended because I followed my heart. I listened to mentors. I knocked on every door. So just let your heart guide you. Trust the mentors that, are put in your path. Knock on every door. Don't give up, and just know that the end is worth it.
That's so beautiful. Thank you so much for that advice, and thank you so much for sharing your story and your heart with us today.
You've inspired and are still inspiring so many of us by taking us along your journey through med school and even after med school, with your platform and by joining us here on today's podcast. To everyone tuning in, thank you for joining us on this episode of Battles and Voices. We're so glad that you spent your valuable time with us today. Keep listening for more incredible stories like this one.
If you enjoyed today's conversation, be sure to follow, share, and stay tuned for more voices with vision, values, purpose, and most importantly, the heart. We'll see you next time on Vitals and Voices.